This is from The Hill. The misguided laws contributing to America's rural health crisis.
America's rural health crisis has gone from bad to worse. More than 90% of rural counties face a shortage of primary care physicians, forcing many rural residents to travel for hours, even for basic procedures. Over the last 2 decades, nearly 200 rural hospitals have shut down. Hundreds more hospitals teeter on the brink of bankruptcy, threatening to deprive millions more of people of the vital nearby care. In fact, a lack of adequate access to healthcare has contributed to the widening health gap between rural and urban Americans. From 2010 to 2019, while life expectancy rose in urban counties, it declined in rural parts of the country. In 2020, for example, rural counties experienced higher than average COVID-19 death rates. And in newly released research in the Southern Economic Journal, we show that misguided government policies are pouring fuel on this fire. We study certificate of need laws, which require healthcare providers to obtain approval from state officials before offering new services, expanding facilities, or investing in technology. Currently, con laws exist in 35 states. A large amount of evidence shows that these regulations limit competition and drive up prices in the healthcare industry. But our study is one of the first to examine their impact on rural America. Some policymakers insist by controlling where additional health services can be offered, they can direct providers to invest more in geographically remote and undeserved areas. Without con laws, the argument goes, profit-hungry providers would solely focus on urban centers. For example, the West Virginia Healthcare Authority, the agency that oversees the state's con program, argues, in West Virginia, the con program offers some protection for small, often financially fragile, rural hospitals and the underinsured population they serve by promoting the availability and accessibility of services. The Kentucky Hospital Association has made similar claims, warning that repealing con laws would be another nail in the coffin for rural communities.
It'd be simple. Get rid of con laws and make healthcare free for all, because the problem is the hospitals aren't getting their money because people are uninsured or underinsured, and so the hospitals lose money. So it all goes back to, if universal healthcare was a fucking thing, hospitals wouldn't have to shut down.
They wouldn't be running on a profit motive. They would just be available where they're needed.
And the bad thing about running on a profit motive, specialists who have very high ratings for something, let's say along the lines of a cancer specialist, if they have high ratings, understand that the reason they have those high ratings is generally because there hasn't been deaths at their hospital. And so when they get deaths, it loses them money, but if they help people, they will get the money. If you're terminal and they know that they can't help you and they know that you will die, they will just not accept you as a patient because it will look bad on their numbers. So that means that people that are in end of life that need care, that could, there are people that have had stage 4 cancer and fucking beat it. But to turn away somebody that's at stage 4 because you think it could hurt your rating, that's against the Hippocratic Oath. It's against basic morals and the whole point of hospitals.
Yeah, there shouldn't be a profit motive in the pursuit of life, happiness, or death.
Or health, or education.
Yeah.
Or just living in general.
They should just be the rights of humans.
Not in this country.
However, this narrative could simply serve as a pretext for existing hospitals to keep potential competitors out of their areas. In many states, the con application process is lengthy and expensive, placing a considerable burden on smaller and newer providers. In contrast, larger and more politically connected organizations are usually more adept at navigating all the bureaucratic procedures.
Correct. So also when you have those big hospitals, and you have somebody that works there and they realize that, let's say it's a profit motive, so they want to, branch out and open their own office and do their own private practice. Now they have to go through and get everything situated, not just to open on its own, but also to accept people's insurances. And that's just a whole other step and a whole other mess that a lot of private practices run into. That there might be a lot of private practices, but your insurance won't let you go there. I'm
sure the contributing factor to hospital closures is insurance companies denying claims.
Oh, yeah, for sure. Yeah. And them charging an arm and a leg to give you a Band-Aid. That's also a problem.
$500 to hold your kid after you poop it out.
Even though they tell you that you have to do, that you have to. It's medically going to help.
That's crazy. Yeah. $50 for a tissue.
And then they put it in an incubator anyway.
Yeah. No. To test these competing theories, we analyzed nearly 30 years of data focused on 5 states: Nebraska, New Hampshire, North Dakota, Ohio, and Pennsylvania, that have repealed con restrictions on hospitals since the early 90s. Relative to states that kept their con laws in place, these 5 states experienced a 3.4% increase in rural hospitals per capita in the years after repeal. Nationally, they would translate to roughly 70 additional hospitals serving rural patients.
See, I don't understand how we have data and stuff that proves that something works, and we're still just like, nah.
Yeah. Instead of deepening healthcare shortages in rural areas, repealing con laws led to more access to hospital services. Moreover, we find that repealing con laws increased the number of hospitals in urban areas too, indicating that these laws are restricting beneficial competition in all areas of the country. Con laws deter new hospitals from forming, and by doing so, exacerbate the rural health care crisis. Established hospitals are highly incentivized to derail the con applications of potential competitors to protect their turf, and hospital associations lobby aggressively to keep these protections in place.
So fucking disgusting.
Maureen Aholson, a former commissioner of the U.S. Federal Trade Commission, put it bluntly, con laws serve primarily, if not solely, to assist incumbents in fending off competition from new entrants. Our research supports this claim. If policymakers want to address the crisis, repealing these anti-competitive, anti-healthcare consumer laws would be a good place to start.
Nah, there's too much money that's paying further against that.
We experienced this ourselves in small town. So. This is from MedCity News, the challenges of providing healthcare in rural areas.
The lack of proper healthcare infrastructure, human resources, equipment, and funding can reduce the quality of care in rural hospitals and clinics. It's crucial to improve the rural healthcare delivery models and provide quality care to the residents. Typically, hospitals in rural areas are much smaller than the ones we see in bigger cities. Regardless of their size, rural healthcare plays a significant role in keeping the communities healthy and sound by offering emergency care for people. Sometimes they collaborate with urban health systems to provide specialized and primary care. Although rural health professionals can provide urgent, quality, and compassionate care to the people there, obstacles still complicate things for patients seeking rural care, because in many cases, rural care isn't enough for the patient's needs. Over 60 million Americans, 1/5 of the U.S. population, are rural residents. Many of them are older and have severe health conditions. Therefore, they require more medical attention and care wherever they are. However, in many rural areas, people have limited access to healthcare services, including minimal specialized care. Many local hospitals in rural areas are seeing closures. Residents must travel long distance to seek even the standard services in the nearest hospitals. They might need to travel further to find specialized services like substance abuse treatment. Due to socioeconomic issues, we might see many rural residents have no insurance coverage, which prevents them from accessing the care they need. In rural America, a shortage of healthcare professionals presents significant challenges. Here are key reasons and potential solutions. Cost of medical education. High medical school costs deter doctors, especially when primary care roles in rural areas offer lower salaries. Limited job opportunities. Fewer healthcare facilities in rural areas means fewer job openings for healthcare professionals. Scarcity of resources. Poor healthcare resources and facilities make comprehensive care difficult. Recruitment and retention struggles. Rural healthcare providers find it hard to attract and keep staff, leading to burnout and staff shortages. Negative consequences. Doctor shortages result in longer wait times, reduced care quality, and limited specialist access. To improve rural healthcare, support networks, establish support systems through telehealth and mentorship, specialized training, provide training for rural-specific challenges like telehealth and chronic disease management. Government initiatives. Offer financial initiatives for rural practices and improve infrastructure with broadband access and reliable transportation. Rural areas lack technology and telemedicine. Technology and telemedicine significantly improve healthcare delivery, especially in rural places when resources and opportunities are scarce. Rural doctors can use telehealth to connect with other doctors for advice, receive training, and improve health outcomes. But often, rural areas don't have access to high-speed internet required for telemedicine services. Rural residents do not own smartphones in some areas, which is crucial to accessing telehealth services. All state requirements for telehealth licensing and credentialing aren't the same, so it can make things difficult for healthcare providers who wish to provide care through telemedicine. Similarly, reimbursement policies for telehealth are different from state to state. Lack of modern technology may also make it difficult for doctors to exchange electronic health information in rural areas. Rural residents may be skeptical about the quality of telehealth services or concerned about their data security and privacy. However, all these problems can be solved by taking a few measures over time. Stakeholders should fund telehealth programs, expand reimbursement policies, and create awareness of telehealth services to encourage rural residents. The lack of proper healthcare infrastructure, human resources, equipment, and funding can reduce the quality of care in rural hospitals and clinics. It's crucial to improve the rural healthcare delivery models and provide quality care to its residents. It's why the government, investors, healthcare providers, and every other healthcare stakeholder should focus more on healthcare education and awareness while addressing the challenges related to infrastructure and resources.
Yeah, so we live in a rural area, and it's hard to find good doctors that know what they're talking about. Will listen to you, and respect you,
help you,
and
help you in a timely manner.
Treat you like a patient instead of like a drug seeker or something. It's hard to find decent doctors. The nurses don't want to be there. The receptionists don't want to be there. They're all arguing with the people in the lobby with each other. It's a common occurrence every time. We don't go places often, and it seems like every time we do, there's a kerfuffle.
Just that if I die, it's SIH's fault.
Yeah.
Everybody's gonna die.
They were gonna leave. One of my relatives had kidney failure. They were gonna leave her bad kidney inside of her. It gave an infection that went to her brain. She had to go to a city doctor, and they took the kidney out, and she's fine now.
Before they even did that, they also made her undergo multiple unnecessary surgeries in an attempt to save what was already unsalvageable.
I mean, she was in a catheter for 6 months. She was putting tubes in and out of her. Like, why? Why put her all through all that suffering? And when a savvy doctor knows exactly what he should do, it's just. Yep.
Yeah. In the past 2 months, we've been to the ER 4 or 5 times. And I've seen my doctor at least a dozen, including a telehealth appointment. And I'm still in pain, and I still don't know why.
Like, you can't figure out what's wrong with her?
It's getting harder to walk.
Like,
to stand.
It's so frustrating. It's just like all the services in the rural area are half-assed. And the people around here, the ones that provide the services, they're small town people. I mean,
so there's no rush on anything. And appointments are months out. It took me 6 months to see a rheumatologist. And that was after a year of trying to get my provider to refer me to one. So.
And when we first got in this area, our primary doctor was someone who we liked. And he even told PD that he was going to the VA because they were going to cut his pay at SIH by 30%. So, like, we're dealing with doctors who aren't
even being paid adequately.
Yeah,
so.
And you expect
them to care.
The good health outcomes? I don't think so.
It's hard to care when you're not making enough money and you're slaving away at something.
And it's the center of the issue is the profit motive. There should be no profit motive in healthcare. It should be nationalized. It should be governed by the people.
I can't get a testing
with
done.
With our best interest in mind at all times.
I can't get testing done that I need because they keep running into issues with my insurance.
They don't even know how to deal with the insurance. It's the simplest shit ever. We had to do most of the stuff ourselves. We had to like get it like simple shit, fax shit to here. Send a fucking email here. It's like I have to tell you.
Yeah.
I mean, I'm sure they have their own thing. But it gets frustrating, and after a while, you just have to.
Well, I understand that everybody has their bad days, and that's understandable. But when it's every time. When I'm messaging you on the message board and you don't send it to my provider because you don't think it's necessary, and I'm begging you to do anything because I'm in so much pain, give me anything. I don't care. You give me Tylenol. I don't care. I need something else. Just tell me what else will make this stop.
We'll probably have to go to the city and have you get a doctor because it seems that all the doctors around here just are clueless. I don't understand. I
can't wait for this to be done. And every time they're like, oh, we're going to schedule you an appointment for this testing, you get this moment of hope because I'm going to finally figure out what's wrong with me. I'm going to have an answer, and then we can get it taken care of. I don't have to be in pain anymore. I can just go back to my life as it was. And then they call you and they tell you, oh, we're having an issue with the insurance. We're going to reschedule you a month out. And then they call again the day before the appointment again to say, oh, sorry, we're having an issue with the insurance. We're going to schedule you another month out.
People have to get back to work, dude. It's crazy. She even told them how the fuck to do it because she's in this industry. They told them how to run the insurance. Don't run it through the primary, run it through the secondary. And it worked. And they came back the next month and said the same exact shit, dude. They don't give a fuck. They just want us to die.
And when I explained it to her and got frustrated and raised my voice, she hung up on me. And then she canceled my appointment the morning of the appointment. And then she called my primary and had my primary nurse call me to tell me not to go to the appointment.
Little bitch. Or fucking need help.
Dude, like for real.
It's like when I had a kidney stone when I first got here, and they referred me to urology. I go to urology. The nurse is a total cunt. She didn't have something from. I used to live in Kansas City, so like, they needed some from Kansas City, and they expected me to provide it. And I'm like, what do you mean? So you can't like fax the shit? You can't email the fucking photos? Like what is your fucking? And I say to her like, I don't understand how it's my responsibility to just like be your middleman for the professional health people. And she was a total cunt. She laughed at me. She scoffed at me the entire rest of the time. I left the appointment and I never went back. I never figured out my kidney stone or anything, just because they're incapable of getting anything done correctly. Like, why the fuck would I even let you? Like,
I get you hate your job. And again, everybody has their bad days, but understand that this has been a continual thing for us.
It's like every time we interact with these people, with the healthcare, with the state, with insurance, with work, they're all just trying to fuck us. It's like the moment they think that you're useless, they just treat you that way. They treat you like you're worthless. The moment you have an ailment, the moment that they can't make the fucking value on it like a fucking dime, you're done. You're over. It's capitalism. Yep. Get another fucking job. You think it's so easy? Yeah. Fucking economy's bullshit, dude. The fucking service jobs, a gig economy. Fuck you.
I just don't want to be in pain anymore. I didn't think that was too much to ask. That's all I want. I can use a Band-Aid until you figure shit out. I'm fine with a Band-Aid right now. Band-Aids aren't permanent. You can work on getting everything else figured out while I have my Band-Aid and can continue my life, but I can't even get a Band-Aid.
They don't make the shit anymore. They don't make actual painkillers anymore. You have to take a fucking NSAID that's a fucking on steroids, or take a steroid, or take a fucking Toradol. They don't give shit for what? I'm just gonna fucking scream. So.
You're just getting angry.
Because I was gonna talk about how one of my managers I used to work for, her son was like 6, and he broke his arm on his bicycle. They took him to the ER. They wouldn't give him hydrocodone because he's 6. He's screaming in pain, and his fucking bones coming out, and they won't give him hydrocodone because he's obviously a fucking drug seeker.
Yep. Under the age of 12, they're not.
I'm not sure if it was hydrocodone. They wouldn't give him pain medicine. Fine. I'm sorry.
They wouldn't give him anything for pain. Yeah, that was ultimately what it was. Just like I broke my arm when I was a little kid, and they injected me with something in my hip that made me go night-night. So I don't even know what it was. I just remember the shot hurt more than my arm. It's the first time I ever got a shot in my hip. Fucking, oh man, it's not fun.
I've had a few, but they never seem to incapacitate me.
Well, you've seen how many I've had lately.
Like you don't understand though. Like I've been held down, give Thorazine shots. I've been held down, give shots in my back, and I just get right back up afterwards. And I'd have like even a few times like one of the like people that work there like take me aside like, bro, just lay down for 30 minutes, please just lay down for 30 fucking minutes. Like they were begging me. I'm like, I don't even know what I'm doing wrong, guys. Like, what do you? I don't even know why you're giving me the shot. Like, I'm just confused, mental ill person. But yeah, it never seemed to do anything to me. Thorazine, whatever the fuck else to give the shot in the back. I don't fucking know. They just hold you down and put like 3 shots in your back. Did you get that?
They didn't hold me down, but I mean, you've seen me at the hospital and stuff. Pretty much anytime they're like, "We're gonna give you a shot," I'm like, "Okay." And they're like, "No, in your butt," and I'm just pulling my pants down. Like, just fucking do it. Like, I am afraid of needles. Understand that. I am terrified of needles. I can't even look at them or I will start freaking out. But every time they're offering me anything, I'm just like, now, where do you want to give it to me? In my ass? Fuck it. Stab my ass. I don't give a shit. Just fucking make it stop. It doesn't work.
Niggas living with pain is debilitating. It's on the front of your mind all the time, every step you take. It's just
every hug.
Chronic. It's chronic. It's a chronic illness.
I'm just so tired.